the pros and cons of being a physical therapist, just that you're a bit more informed if this is the career path you want. Hopefully help some people who are looking to get into the field. Pros of PT. Good job security. You won't really have an issue finding a job. If you need to travel, go to a new state, you could easily find places that are hiring. You could always have a job pretty much. We've seen recently in the tech market, people are being laid off and it's hard for people to find jobs. People are applying for a year or so before they even get a position. So that's not something that PTs have an issue with. You also have a higher than average income, right? So the average income in the United States is, wow, $39,000. So about $40,000 average PT salary. $99,000, which is according to the Bureau of Labor Statistics, which honestly I've never seen that amount. So that's actually kind of crazy. Different settings you could, like health and such. Freaking almost 6 figs, right? It's pretty nice, but as we've seen, the cost of eggs and everything, that's like really too much. Taxes, paying for housing, all that kind of stuff. But definitely higher than average and having good job security, I mean, those are all pluses, right? It's a meaningful job. Something that if you like to talk to people, if you like to help people, and it puts you in that role, you are more of an authority as well. So if you're an active individual, if PT, exercising, being healthy, all that kind of stuff, you like to promote that in other people, you like to help other people achieve their goals, or things that is what makes it meaningful. And so it's something, if you have genuine interest in, then I think that it is actually something that does help to motivate. It does make it a bit easier at the end of the day. The pros that there's also lots of different settings and fields, right? So there's outpatient, acute care, pediatrics, neurological cases, cardiovascular, like these different things around the globe, around the spectrum. And you get bored of one, you can always go to another. If like you could just like different settings out and everything, see what you like, and you always carry over, and it's pretty meaningful in that aspect. So not a lot of other fields can do that, or you need a lot of experience or such in order to do so. But with PT, as long as you have the degree, you can easily switch to a different setting or position. Some of the cons, right? Documentation. So everyone's favorite thing is tedious. Of course, it's required and necessary in order to justify therapy for insurance companies and such. Something that also depends on the type of system that you use, right? Like for certain EMRs, electronic medical records, that are easier and makes it faster than others to do documentation with. So it's something that does occupy time. You're able to write the documentation while you're with the patient, and you're done seeing the patient, you're done. Sometimes you're like, there's like so much things going on, you can't finish it. Then you see the next patient, they have a lot of problems, can't finish it. See your next patient. At the end of the day, you have like notes you have to write or whatever like that. 5 on a good day, you know what I mean? Like it's not too bad. But let's say you have a full caseload. It just depends on how many patients you see per hour. And it could be kind of rough to like either having to do at home, do it the next day, staying late. It's got to be done though. Documentation is everyone's least favorite thing to do in PT. Patients, right? So sometimes you have people, and any sort of like interacting with customer or patient or whatever like that, you're gonna have difficult people to deal with. Either people with unrealistic expectations, who are coming to therapy just because they want a massage, family members who don't do too much on their own, like telling them to do, and as a result they're not getting better, and then you still want to keep coming to therapy. So there's difficult patients, but it's normal with any customer facing role. The debt is what I talked about earlier. So be prepared. If you could go in without student loans, that'd be great. But if you're going with loans, try to limit how much you're taking out. Low ceiling. So the issue with PT is that payment is based on reimbursements rates that are set by the government for Medicare. Right, a lot of other of the HMOs and different insurance companies, private insurance companies, they followed along with Medicare. So when Medicare is being cut, which it has been year to year, then all these other private insurances are also going to cut their rates. And as a result, practices aren't able to make more money. And so they can't justify paying you more. So you might be getting like maybe like 1 or 2% raise a year, which is eventually going to cap out at a certain point. And just the con of it, again, we have good job security, we have higher than average income, but as a result, we have lower maximum growth. And The first job I worked at, there were people who were working there for 10 years doing mentorship, treating advanced patients, everything. And then when we had an honest conversation about our salaries, turns out me as a new grad, I was barely making, they were barely making more than me. So this just goes to show that you can have all this specialty, you can have all these certifications, advanced degrees, and all this years of experience and be providing to value to these patients. But whatever they bill is the same as what I bill. So you can't, company, the hospital can't justify paying them more. Of course, there are different practices that may be able to pay more, but again, there's an upper limit to what I've seen. Even going into management and such is like you're doing a lot more work, and then you're getting maybe just a little bit more pay, so it's not also ideal. There are a lot of things out there right now talking about like base practices and everything, and that's cool and all, and that's a way so you can set your own rates outside of insurance. And if it's something that you can do, it's awesome. Something I looked into myself, but definitely not as easy as people say. So if you have a niche, if you have an expertise, if you have all these networks and all these people, you could definitely freaking make it. And then that problem of being a low ceiling would be resolved.